दीक्षा?
हाँ मैम, अभी
आना चाहिए, एक दो मिनट में
yes.
हाँ हाँ
हाँ, एक मिनट में it should show you. यहाँ से I've taken live on both platforms, YouTube as well as.
हाँ हाँ हाँ.
Now you can check. So we have 2 minutes to go. So once you confirm, then we'll.
Yes, perfect. Perfect. It's showing live.
Great, awesome. So we'll start in 1 minute from now, as per the schedule time.
Yes, my dear.
You have people who have registered, or it's going to be just spontaneous?
नहीं मैम, ऑलरेडी आपको सब भेजेंगे ना बाद में, कितने रजिस्टर थे, कितने लाइव शो, कितने लाइव ऑडियंस है, आपको भेजेंगे बाद में. हाँ.
Okay.
Everything will be shared.
Everything will be shared, मैम. कल जो हम लोग ने किया था, कल का हमारे पास था, मैं बताती हूँ. कल नहीं, कल ही तो किया था.
आपका थोड़ा नेटवर्क गड़बड़ है.
मेरा बारिश हो रही है ना मैम, बहुत बारिश हो रही है यहाँ पे. मैंने दीक्षा के पास भी क्वेश्चंस है, अगर मेरा नेटवर्क गड़बड़ करेगा तो दीक्षा भी पूछेगी, मैंने बोला है. इट्स हेवी, वेरी हेवी रेन्स एट प्रेजेंट.
I can, as of now, I can hear you clearly.
You can hear me clearly, Diksha?
Yeah. बिल्कुल.
So is there anything
Yes,
wrong with my network? Because तुम्हारा भी थोड़ा मेरे को ना वैसे disconnected सा मिल रहा है, दीक्षा. तो is my network okay? Can you hear me?
मैम, आपकी आवाज तो मुझे ठीक आ रही है, आप दोनों की आवाज perfectly fine आ रही है.
So good. All right. That means we are good.
Okay, so it's sharp 8:30 now. So we are live now. Good evening, everyone. I, Diksha Gambhir from Medisage E-Learning Private Limited, a leading platform dedicated to empowering medical professionals through knowledge sharing, expert insights, and digital innovations. So proudly welcomes you to today's Med Talk on clinical perspectives on breastfeeding. Insights are coming from our two gynae experts. So we are honored to welcome you both, Dr. Ritu Santwani and Dr. Divya Singhal. So to talk about Dr. Ritu, she is a globally recognized obstetrician, gynecologist, infertility specialist, and sexologist, known for her holistic approach to women's health. She is the founder and CEO of 360-degree Healthcare Studio, NUHS Singapore, and holds prestigious qualifications including MBBS, MD, FICOG, FIAOG, and ART Singapore. Recognized amongst the top 50 most influential doctors on social media. She also serves as co-founder of MAAM and board member of SWWC, working actively to advance women's health globally. So joining her today with us is Dr. Divya Singhal. Dr. Divya is MBBS, DGO, FICOG, and a distinguished consultant in obstetrics and gynecology. She currently serves as the national coordinator of the Breast and Puerperal Committee of FOXI and is the immediate past president of Delhi Gynae Forum North. Her outstanding contributions to medicine have earned her several prestigious honors, including the APJ Abdul Kalam Excellence Award and the Pride of Delhi Gynae Forum Award in 2023. Dr. Singhal has also played a key role in developing national breastfeeding guidelines through FOXI and has a keen interest in breast and cervical cancer prevention. With that, I warmly welcome both experts to the session today and hand it over to Dr. Ritu to take it forward from here. Dr. Ritu, over to you.
Yeah, thank you, my dear Diksha, and thank you Medisage for providing the platform for such educational initiatives. So I think I will give some credit to my dear Diksha also. Diksha is constantly after me कि मैम एक शो खत्म हो गया, दूसरे शो का प्लान करो. So thanks to you also, Diksha, and a very warm
pleasure, Doctor.
Divya madam. Madam, really we are honored to have you with us. Ma'am is doing enormous work in the breast feeding committee. So I know her, ma'am, from the years. So ma'am, really thankful to you for sparing your time for this wonderful discussion. As we told you, this program is entirely based on question answers. That's why it is very popular amongst all, because there is no PPT. Whatever the questions, once we put the flyer, so whatever the questions we receive, we will take that questions. From the stalwarts. The program is going hit from the time of the lockdown. due to the, I can say, by the help of the all the stalwarts, though it is not easy to get all the stalwarts on the platform because managing of the time is very difficult. But really grateful to you. So, ma'am, with your permission, shall we start the questions, or you want to say something first? Then we can start.
Just want to thank you, Dr. Ritu Santwani, for having me on your show. And it's really an opportunity and honor for me to be here with you, with such a charming and such a lady who has such great foresight into looking at holistic outlook, which is so important to heal the patient in all ways. And I think your charm also helps a lot. Your aura helps a lot, and we have so much to learn from each other, and I'm raring to go. And please let's start the conversation regarding breastfeeding.
Thank you so much, ma'am. Ma'am, as we all know that we obstetrician always advise the mother कि आप जब तक अपना बच्चे को दूध पिलाओगे तब तक अच्छा रहेगा. That is the baby mother's milk is the gold for the baby. So now first in common query, as lot of doctors have also asked this question, that what are the most common breastfeeding challenges what you see in your practice? Being in my practice in the corporate area, I see most of the girls are coming and telling me कि मैम मेरा फिगर खराब हो जाएगा. Then we have to counsel and tell them everything. So what are the most common problems you are facing, ma'am?
So the common problems, Dr. Ritu, we face are like, the patient lands up with painful nipples. She says, "Oh, I got sore nipples. Oh, I've got cracked nipples. Oh, there's blood coming out. It's so painful to feed the baby. I'm so exhausted. I don't want to feed the baby. He's crying and he or she is crying all the time." So there are, so many challenges actually the poor mother faces. And then there is breast engorgement after 1 or 2 days, or there could even be a breast abscess because she's not feeding correctly. So the answer to all these questions is that we start teaching the patient, the would-be mother, during her pregnancy, how to breastfeed and what is the importance of breastfeeding, how to actually prevent sore nipples and cracked nipples. And because as far as sore nipples and cracked nipples are concerned, painful nipples, then it's actually the latching problem, how the mother latches on the baby to her breast. So I have a model, Dr. Ritu, if you want. I mean, like, this is
Yes,
it.
yeah,
So
please. Yeah.
what happens is, like any mother who doesn't know how to breastfeed would probably stick her baby onto the nipple only, and she would think it's from the nipple that the baby is going to suck and get the milk. But this is not so.
Yeah.
The nipple is just like, the outlet for milk, and it's the areola, this brown area, which should actually, three-fourth of it should go into the baby's mouth. And it is from here that the sucking should take place, and not directly from the nipple. So the mother will then never have a painful nipples. This is very, very important. And then, of course, the positions matter so that, she doesn't get tired. The mother gets tired, and it's actually, I think this is a very, very important problem. And then the poor mother, she keeps feeling guilty about it. Okay, I'm not able to feed my baby. I don't have the stamina, but she continues to struggle hard. So, these days we propagate lying down position for breastfeeding. So, lying down on the sides, on each side, she can breastfeed the baby. She's rested, and so is the baby. They both are not cranky, and then the baby can feed. As far as preventing engorgement is concerned. So emptying some mothers produce extra milk. So and some mothers don't feed for a long interval of time, say about 4 to 6 hours. So the milk keeps collecting in the breast, and then there is engorgement. So because there is no outlet for the milk, then it gets engorged, and because milk is a very good culture medium for bacteria, so then it can even lead to a pus formation and a breast abscess. So that becomes even worse for the mother. So every 2 to 3 hours, she needs to empty the breast, and the best way is to feed the baby, put the baby to the breast. Uh, or if she's very tired, or if the baby is sleeping, then she can actually manually express the milk and put it in a katori and then feed the baby later. So we'll talk about the rule of 3 or 4 in a while. So of course, then we have the NICU baby. So these are various problems which probably we'll discuss over time now.
Yeah, thank you. Thank you so much. Ma'am, as you have very rightly pointed out, so here is coming one another question in my mind as we are seeing a lot of the working mothers with us. So yet after the maternity leave of 3 months, or sometimes they are extending up to the 6 months, once they join the work, then there is a big problem because all the offices these days, we are recommending that all the offices should have a breastfeeding room, like the airports are having, now the railway stations are also having. So in that cases where the offices are not having this breastfeeding room, so what advice we can give, how they can express the breast milk and can store? So please share some practical tips for the upcoming doctors. So they are very much interested for listening for about this.
Absolutely, absolutely. In fact, even in our days, Dr. Ritu, we were also working as doctors and we did not have this insight into how one could store the milk. So, milk storage for working mothers is a real boon, and it is a reality which, helps her out through the time when she's in the office. So, what she does is right from the beginning, whenever the baby, when she's with the baby, that is in the first 3 months or the first 6 months, what she does is she starts storing her extra milk. She pumps either manually or she uses an electric pump, and whatever extra milk she has, she stores them in different, glass utensil jars, which can be shut tight. Then she puts the date and the time when she stored it, and she puts it in the freezer. So the rule of three says that if for storage of milk, there is a rule of three, which says that if the mother takes the milk, her own milk, and puts it outside at room temperature, then it's good for 3 hours. And if she puts it in the refrigerator, then it's good for 3 days. But if she freezes the milk, it is good for 3 months. So if she's put the date on if she's labeled the time and the date, then that milk can be utilized by people who are at home, either the maid or even her own mother-in-law or mother. They can actually take the milk out and then thaw it and give it to the baby. So that way, breast milk can be provided to the baby even while the mother is at work. That is one way. The second way, of course, is that she must insist on a little bit more of maternity leave and stretch it as far as she can. And the third way is that, these days the government is allowing small breaks for breastfeeding, especially for breastfeeding mothers. So in that break, if the baby is brought to the office,
Yeah.
or if mother is able to reach the home, so probably, at least once in during her office time, she could feed. But of course, this sounds a little impractical for people who are lucky to have their houses near their office. And then now we have the hybrid system. So work is for, like, in the office is 2 days a week, and the rest of the days they can work from home. So there are a few opportunities many opportunities in which working mothers can actually breastfeed their babies for a longer time.
Yeah, thank you. Thank you so much, ma'am. Ma'am, here comes the another question related to that only. As we have told that we can store the milk in the freezer and then can thaw and can give to the baby. So the thawed milk can be used only in the one sitting. I want you should clarify a little bit about more about that.
Absolutely,
Yeah,
absolutely. So one is how to thaw the milk and
yeah,
how long can it be used.
yeah,
And only for one sitting, like you rightly said. And so thawing is like, the person who's giving the milk, she takes a utensil, a steel utensil, fills it with warm water and puts that glass jar in that warm water, and slowly the milk gets thawed, and that can be given by katori chammach to the baby, but it should be finished in the next 2 hours and not reused, not refrozen.
yeah.
That's
So
right.
So very rightly, madam has pointed out. And friends, we have to remember that milk we have not to heat in the gas directly. We, as madam has rightly pointed out, that milk you can keep in the glass or in the bottle, that you can keep in the hot water, not to heat directly. That is very important point. So thank you, madam, for enlightening about that. Now coming to the next question. So as in the cases we are seeing the some babies, as you already told, in the NICU, or we are seeing sometimes the preterm birth. So in that case, what is the advice? How can we manage that patients in that case?
Yes, till now, Dr. Ritu, this is a very, very important and good question. In fact, till now, what we used to do, baby's gone to the NICU, and we used to discharge the mother and tell her, "Ki whenever you get the baby back, and that is the time when you should try and start breastfeeding." But now, NICU babies, the babies who go to the intensive care unit for neonates, then over there, breast milk can be sent as soon as the pediatrician or the neonatologist signals to the mother or to the obstetrician that yes, the baby is ready for oral feeds, which could be either through the tube, or it could be through tube feeding, or it could be direct oral feeding. So even if it's a preterm baby, even if it is a FGR baby, but if the baby is ready for tube feeding, etc., then human milk and especially mother's milk should be used for breastfeeding. So manual expression has to be taught to the mother, and she can do it. There is nothing which sounds like a challenge, but it is not. And in fact, in these days, there's a new method of doing NICU thing. So that is kangaroo baby care, where the mother is actually admitted along with the baby, and the baby is put on her chest and tied to her like a kangaroo's baby is tied to the kangaroo mother. And then, they both lie down. And since the baby is on her chest, directly on the chest of the mother, then the baby suckles whenever the baby wants to, and the baby is warm, and there is a mother baby bonding. Otherwise, what happens? The baby is sent to the NICU, and then the mother baby bond is disturbed. So, this
Very,
is
yeah, very correct. Yeah, thank you so much, ma'am, for that. Ma'am, now another very important query comes, because sometimes our juniors also drop us a message related to that. That, madam, we have received a patient is lactating. So we can give which drugs, or you can say what are the drugs what we have to keep in our mind, that if the mother is lactating, we not advise that drugs. I want that you should highlight only 2, 3 important drugs what we are commonly.
basically, we don't like to give tetracyclines, doxycycline, etc. And the safe drugs are amoxicillin. The safe drug is cephalosporins. These are the ones which can be given. Suppose the patient has urine infection or something like that. Even in fact, it's better to give cephalosporins rather than amoxicillin, because amoxicillin with clavulanic acid can cause necrotizing enterocolitis in the baby. So it's better to avoid that also.
Yeah. Madam, there is one question is received. I just received in my WhatsApp. That is by Dr. Ruma. Dr. Ruma, she is writing from Chhattisgarh. She is joined from Bhilai. Bhilai. She is writing what you suggest if the mother is on some chronic illness, if she is taking the ATT, how safe to continue the breastfeeding?
Again, very good question, Dr. Rohan. Thanks for the question. And as far as ATT is concerned, in the first 1 or 2 months, if the patient is has a contagious infection, an open tuberculosis, that is, then it gets rectified in the first 1 or 2 months. So once the patient's physician says yes, she is now non-contagious, non-infectious as far as tuberculosis is concerned, then the baby can be put directly to the breast for breastfeeding, or otherwise manual expression of the milk, and then that can be given to the baby. So similarly, there are other chronic diseases also, as long as it is not infectious for the mother to hold the baby, and she would give the infection to the baby. So then it's safe to breastfeed.
Thank you. Thank you so much, ma'am. Ma'am, we have received one query related to the twin babies. So, is it some points what we have to keep in our mind when the lady is breastfeeding for the twin baby? So, what advice you want to suggest, or what are the precautions they have to use?
So So definitely, one is the mental and the emotional preparation, and one has to be positive. The obstetrician, if she's positive and she's able to motivate the patient that yes, you can do it, you can feed your twins. In fact, you will see that there are people who are feeding the twins to simultaneously, because one starts crying and then the other one also starts crying and asking for milk, demanding milk. So both the babies are put on one breast each, and she's able to manage that. But then she needs help. So there has to have to be people with her who are holding the baby, and she's there just to feed the babies. So that is one way. And then her milk production, to increase the milk production, we just have that she should have more fluids, more milk, especially water. Water is a very good thing which people usually abstain from in the first 40 days. In India, they think usse there'll be bloating and there'll be probably the tummy comes out or something like that. But I think this is a myth. And every time the mother breastfeeds, first of all, she should have a glass of water, even if it is warm water. That's fine, or boiled water if that is how they want it. I think that's a very good idea. So, more of liquids, more of fluids, more of nutrition, like more of calcium supplements, and of course, a good high protein diet. A balanced, nutritious diet is what she requires. In fact, that is also one thing that is actually, curtailed, withdrawn from the mother. They're just given like saltless diet, which is full of ghee and no water or very less water. So these are the things that one has to work on, and also on the fact that she can do it. She can feed both her babies.
Very nicely you have pointed out. Ma'am, now another question comes. Yes, we have seen in lot of scenarios, yes, in our day-to-day practice also. Sometimes if they are expecting for the male baby and suddenly if the female baby comes, huh? So the lady sudden goes in the depression. So yes, we know the postpartum blues are very difficult to treat. Yes. So in that cases of the postpartum depression, in that case is how to counsel the lady for the breastfeeding.
Actually, it's basically the whole culture, the social conditioning which the poor lady has gone through. And it's not just for she, but the whole family needs to be counseled at such times. And, they do get over it. It's just an initial disappointment in the family. Oh, we wish we had a boy. But if you'll notice that when they come after 7 days for a postpartum checkup, these type of patients, they're good, they've accepted the baby, and also the father seems to have accepted the baby very well. So this is just just a motivation that is required. And of course, if you feel that she has depression, which could be due to so many reasons, postpartum depression is a reality which we kind of neglect, and we think oh, she's just tired and she'll get over it. And the poor lady also, she's unable to express her depression to the obstetrician, because we're not tuned to it. So we have to get tuned to it. We have to listen to her, what her problem is she not able to sleep, does she not have help, and or does she actually require a psychiatrist's help, and to get antidepressants. So all these phases, like counseling, getting antidepressants, all these need to be looked into, and to give her enough rest. And she should still continue to be motivated to feed her baby. That is also important. But in case you feel no, she may not want to do it at all, then it is best to actually take the baby away from her for a while till she gets over this postpartum blues.
Very true, very true. Thank you so much, madam. Now next important query comes, similarly as we are dealing with some high risk pregnancies. So in the patients of preeclampsia, gestational diabetes, pregnancy with heart disease, so in that cases, what problems usually you see in the cases of the breastfeeding, or we have to counsel these ladies how if these in these patients, because we have to counsel whole the family also in the preeclampsia, eclampsia patients, in heart diseases. So I wanted you should share some practical tips for that.
As far as heart disease is concerned, in which the mother might get exhausted breastfeeding, which the cardiologist would tell the obstetrician, then it is better if somebody manually expresses her milk and gives it to the baby rather than a direct breastfeeding suckling, which can happen time to time. She can keep the baby on bedside so that the baby mother bonding continues. But exhaustion has to be looked into, and she should not be exhausted, number one, as far as congenital heart disease or any other heart disease is concerned. But as far as GDM is concerned, like diabetes mellitus of pregnancy or just diabetes mellitus, then the earlier the breastfeeding is started, the better it is, because otherwise the baby might go into hypoglycemia. Similarly, if she's delivered a FGR baby, a fetal growth retarded baby, because of her HTP, that is hypertensive disorder of pregnancy, then it is best if she starts feeding the baby as soon as possible and as frequently as possible, because the baby is going to take small amounts, being a small baby, so will require small frequent meals. So, which is breastfeed, of course.
So yes, very important these 2 points. Yes, as early as possible, early initiation and the frequent, as madam has told. That is also very important. Now, sometimes the lady approaches us in the antenatal period only. That madam, earlier I had a fibroadenoma surgery, or sometimes some other surgery has happened. They are having some boil. So, is it any precautions we have to suggest that patients, because that patients are already so apprehensive that earlier I had a surgery, now I'm becoming a mother. So is it any precautions we have to use, or there are any chances of the coming of the this breast fibroadenoma again? These are the some common queries usually the ladies ask us.
Yes, Dr. Ritu. In fact, these days patients are going in for breast cosmesis also in a big way. Like there is breast augmentation, there are still implants that they're going ahead with, and then there is onco surgery also, which is happening. More and more patients are getting breast cancer even in their earlier age before they are able to even start a family. So therefore, whenever a breast surgery takes place, especially of the nature of a breast cancer surgery, then the doctor does take this into account that the mother may have to breastfeed later. So therefore, all said and done, she should continue to breastfeed without feeling that she won't be able to do it properly just because she's had a fibroadenoma surgery or an implant put into her breast. So she should be able to feed her baby without any hindrance whatsoever, more or less.
Yeah, thank you so much, ma'am. Diksha, we have received some questions. What I have not covered, you can please take that questions.
Yeah, doctor. So I can see two questions that haven't been covered. So the first question is, ma'am, in what cases do you recommend using lactation medicines to increase the milk supply?
Okay. So basically, the lactation medicines as such are the last things we should take resort to, which we usually do when we are going on our rounds and the patients or the mother complains, oh, she's unable, she has insufficient milk supply. There is not enough milk, which is mostly not true, which is just a fear that the mother has, that she has low milk supply. So first of all, we need to address this problem, that why are we giving her a milk enhancing tablet or a medicine? So that needs to be looked into. Once we've assessed that she really needs the medicine, then the only medicine that has been studied for enhancing breast milk is domperidone, which can be given at 10 milligrams thrice daily dose for about 10 days. So, but having said that, again I repeat that it is the suckling which actually enhances the milk production, and that is what is required. Breastfeeding and constant motivation, that yes, you can do it. And how do we assess that there is genuine low milk supply? Because this is something which is a big concern for the mother. I'm not producing adequate amount of milk. So if the baby is wetting about 5 to 6 diapers per day, then the baby is getting adequate hydration and nutrition from his mom's breastfeed. Number one, if the baby is able to poop 4 to 5 times and it has bright yellow colored stools after 2 to 3 days of meconium, then the baby is enough hydrated and enough has enough nutrition. If the baby is gaining weight according to the pediatrician every week, then there is no need to, feel that she's not producing enough milk. And if the baby is kind of satisfied, satiated after a breastfeed, milk feed, and does not keep constantly getting irritable and is active in between. So all these signs and symptoms tell us that the baby is getting sufficient milk.
So Diksha, as madam has very rightly pointed out, yes, तो हम अब ऐसे ही कन्विंस करते हैं कि जितनी बार अपने को ब्रेस्ट से आप बेबी को लगाओगे उतनी जल्दी आपको ये ब्रेस्ट फीडिंग स्टार्ट होगा और उतने अच्छे से होगा. As madam has rightly pointed out about the domperidone, besides that our Indian diet is very much rich, so we always tell, तो अभी बहुत आराम से जो मिलता है, शतावरी हो गया, गोंद के लड्डू हो गए, फेन्यूग्रीक इज कंसिडर्ड टू बी वेरी गुड, and I usually advise my patients to take fenugreek. This flax seeds are very good, fennel seeds are very good, so these all are considered as natural galactogogues. So
Well said. Well
yeah,
said.
yeah. So Baki, as madam has very rightly pointed out, yes, we give this domperidone perinom tablets on the last resort, कि जब patient को नहीं हो रहा है, we will tell all these things. और ऐसे ही बोलते हैं कि आपकी घर के जो बड़े बूढ़े बता रहे हैं, because grandmoms, your mother-in-law, what are saying to include in the diet, include that. Don't include much more ghee in the diet. That again I am pointed out, because the lactating mothers are coming to us and saying कि नहीं, हम तो बेबी को फीड करा रहे हैं, हमें तो भर भर के घी खिलाया जा रहा है. भाई जितना रिकमेंडेड है उतना ही खाइए, घी उससे ज्यादा मत लीजिए, घी से आपको कोई इतना मिल्क प्रोडक्ट नहीं होने वाला. बाकी very well, madam has covered all the points. Yeah, another question you can take. Yeah.
Yeah. So this is the last question from the audience. That is, how would you approach breastfeeding counseling in mothers with insufficient granular tissue or breast hypoplasia?
Okay, so basically, very few people have congenital hypoplasia of the breast, and it is just if you mean that it's about small breasts, people who have very small breasts because they are thin built, so they feel that they will not be able to produce enough milk. That is again a myth, a misconception. So even if small breasts can produce enough milk for the baby, and that goes without saying, without any doubt. But in case there is insufficient milk and you've tried everything, you've tried all the home remedies, and which includes Shatavari, so well said by Dr. Ritu Madam, and all the domperidones and all, then there are, actually human milk banks nowadays in many hospitals. So even human milk can be resorted to. And earlier what used to happen, there used to be joint families. So if the mother was unable to breastfeed for whatever reason, if she was working or something in the kitchen, then then the breastfeeding mothers, Devrani or Jithani or even the Sas, she would breastfeed the baby. So it used to be that easy earlier. So that means breast human milk, which is now available in banks, and it has been tested for various things like HIV and all, can be given to the mother, to the baby, in case there is a real need.
Okay. Thank you, doctor. Thanks for answering the questions in detail. So
So
now, yeah.
Yeah. So I think we have finished perfectly on time. The show timing is 8:30 to 9. And whatever the questions we have received, we have discussed everything.
Yes.
So thank you once again, Divya madam, for sparing your valuable time with us and enlightening everyone. Because I think this is a great platform for sharing the knowledge, and knowledge always increases by sharing. So yeah, over to you, Diksha. Huh.
Yeah.
Thank you
So
once again, Dr. Ritu, and it was really an honor for me, and it was a pleasure for me to be with you on this platform.
Thank you, ma'am. Thank you so much. Huh.
So with this, we come to the end of the session. So thank you, Dr. Ritu and Dr. Divya, for an insightful and clinically relevant session, and this interaction that was really engaging for our audience as well. And your perspectives have brought much needed clarity to this complex topic, enriching the understanding of many practicing clinicians and mothers. So all those who have missed this session, you can tune into the past section of the CMEs right after this event, and you can watch as per your convenient timings. Thank you so much once again for joining in today with us. Thank you and good night. Namaste.
Thank you. Thank you, everyone. Good night. Stay tuned for further coming sessions. Bye-bye.
Bye-bye.